Hello, my name is Chiamaka Uche, and I'm a third-year medical student at Ohio State University.
Hi, my name is Emma Barrett, and I'm a third-year MD MPH student at OSU.
Hi, my name is Sarah Schlotter, and I'm a second-year medical student at OSU.
We'll be presenting a bystander training intervention for responding to sexism and gender bias in the medical environment. Gender bias adversely affects educational experiences and professional evaluation for women medical students and residents. It has been shown that women medical students are called compassionate and empathetic on evaluations, while men medical students are called proficient and knowledgeable. Experiencing microaggression in medical school is associated with depression and decreased school satisfaction. In one study conducted by the British Medical Association, many physicians acknowledge witnessing incidents of gender bias in select training environments. However, only a few formal resources exist for teaching effective, compassionate, and appropriate interventions against sexism. Therefore, we created this training to equip our colleagues with the tools to respond appropriately. The aim of this training was to interrogate interpersonal attitudes about sexism, equip bystanders with concrete behavioral and communication tools, and to improve the knowledge of institutional resources for responding to these incidents. This was an hour-long training that consisted of a didactic presentation on current literature available on sexism and gender bias in medicine, and a case-based facilitated discussion where we had participants respond in various roles. For example, a medical student would respond as an attending, and this allowed the attendings to see how medical students would want to be supported.
So we began our implementation of this program with a pilot program. We had 12 medical students and physician trainees participate in both the session and a post-session focus group. We distributed all of our participants a pre and post survey using Likert style questions to assess their understanding of the role of a bystander, their comfort with taking on such a role, and their awareness of the resources available to them from the university. We also asked our participants after the sessions if they had felt safe and supported during the sessions, as this was a goal of ours. We do feel like we identified a knowledge gap within our community because we found that only 42% of our participants understood how to be an effective bystander, 33% felt they could be an active bystander today, and 25% knew about the resources available to them prior to our session. After our pilot program, we found that 100% agreed with the 3 pre-test statements that they knew how to be a bystander, that they could be one today, and they knew about the resources available to them, as well as finding that 100% of our participants felt supported and respected during the training.
So based on our initial training session, we found that by using this approach for bystander training, it provided an effective method for helping to teach interventions to use when responding to incidents of sexism and gender bias in the medical settings. During the focus group, attendees had the opportunity to express ways to improve the training, and a majority of attendees verbalized appreciation of the current format and recommended continued training using the same format. Given the success of the training and the positive feedback we received, we are planning to move forward with the new racism bystander training pilot in March. And after that, we're going to continue expanding the trainings to include topics such as transphobia and religion bias. And then subsequently, we're going to advocate to incorporate the training into the medical school curriculum.
We hope this presentation sheds light on sexism and gender bias in medicine and provokes thoughtful discussion on how we can move forward to create a more equitable medical environment for all. Thank you so much for your time. We look forward to your questions and feedback.